Good morning. I am Laura Hughes. I am a Hep C Elimination Coordinator for the North and Midlands. I work for Hep C Later, which supports NHS Drug and Alcohol Services Reach Microelimination. Today I'm joined by the wonderful Sue Doherty, who is a nurse consultant working at Stockport Drug and Alcohol Service. Good morning. Hi, Sue. Thanks for joining me today. Sue has joined me to talk about the hepatitis C treatment that she has recently started undertaking within the service, which is a massive step forward into hepatitis C treatment, and it makes the treatment more accessible to those individuals who use the drug and alcohol service, and also helps to further reduce health inequalities for those service users, for people that are using the service. So morning, Sue. Can you give me a little bit of background about the work that you do within Stockport Drug and Alcohol Service?
So in terms of the work that I do at the service here, I guess I'm the clinical lead, as well as the person who undertakes most of our medical reviews. So starting new people into treatment that require medication and reviewing ongoing sort of medication. So I would lead on all the clinical aspects, which includes the bloodborne virus kind of agenda within the service. And our kind of clinical developments around that.
Fabulous, brilliant. So there's an awful lot that you do in your daily work, and I assume every 2 days are the same. No 2 days are the same, and it depends on what you're presented with on a daily basis.
Yeah, I mean, I have a structure to my week in that I run some regular clinics, but obviously who I see on a daily basis within clinics and who comes in outside of clinics and needs seeing can be many and variable, really. So some of my work is back of house, looking at policy and procedure, and looking at governance and incidents and things like that. And some of my work is much more client facing, really, in terms of actually reviewing care, physical health, mental health, and looking at their prescribing.
Wow. So that is an awful lot that you do, an awful lot. Thank you. So we're just going to move on to talk around hepatitis C treatment. Can you talk me through how you've managed to implement treatment for hepatitis C within the service?
Okay, so if we look at how we have developed our hepatitis C treatment within the service, I think it's important to kind of look at this historically, really. Here in Greater Manchester, we have a very enthusiastic ODN who reached out to Drug and Alcohol Services quite some time ago to develop in-reach clinics. And so for several years, actually, we had nurses from the ODN coming and running sometimes monthly, sometimes weekly, sometimes fortnightly clinics to treat people with hepatitis C. Prior to that, we had to take people to a central or North Manchester hospital, actually, for treatment, which was very difficult, really, because it was a lot of buses for people to get there on their own. And it was a real barrier to care. So treatment really improved, and we managed to get a lot of our service users treated, really, once they started doing some in-reach kind of clinics here. I guess there's two elements, isn't there? There's the element of treatment, but there's the real element of finding people, you know. I suppose I came to Stockport actually in 2018, and at that time this service wasn't doing lots of testing around bloodborne viruses. It had kind of fallen off the agenda and appeared to be nobody's job, really. And so I guess there was a lot of work that we did in terms of staff awareness, staff training, building confidence, but also leadership and actually just getting on and doing it. So within every medical review, bloodborne viruses was always reviewed. And if they didn't give me their finger to get pricked, then it was the exception, really. As time has worn on and Hep C Later kind of developed and grew up, and we managed to bid for bits of money, we were able to do some much more targeted auditing work, looking at who actually we needed to be testing, and that's been really valuable in helping us get to micro elimination. I think training and confidence boosting for staff is really important. We also developed an incentivisation scheme, so people get a £5 supermarket voucher for testing, which really encourages some people to engage in the testing process. So there's the finding, and then there's the treating.
Yeah.
So we've got quite good at patient finding. We got very good at treating the ones that wanted treatment, really, and we were left really, I suppose, about 6 months ago, where we'd got 4 people in service who were still hepatitis C positive. A couple of them had started treatment and dropped out, and a couple of them had declined to engage with treatment. But we'd reached a point where actually we didn't need specialist nurses coming here once a month or once a week or once a fortnight to deliver sort of treatment. And so we, I guess, worked with the ODN to look at how we could become a direct treatment centre ourselves. So I think in terms of the initial setup, there were potentially 2 magic ingredients, really. One, a lead consultant within the ODN who was infectiously, I guess, keen to enable us to develop, and us here who were infectiously keen to develop. So relationships, I think, are really important, and I've worked a long time alongside this consultant, so I suppose there's a mutual professional respect and knowledge that we would be able to manage this system. I've also worked a long time alongside the ODN in monitoring people undertaking hepatitis C treatment. And we had previously developed SOPs to allow us to store medication here for clients that they'd started in treatment, such that if they missed their clinic appointments, we could actually issue the medication to the clients under a kind of pro forma system. So we'd kind of dipped our toes in the water, really. So we developed with the ODN a memorandum of understanding that did go through our chief pharmacist at the trust, because obviously it involves us storing and issuing medication, although we're not involved in prescribing it. Again, I think relationships are really important. I've known and worked alongside our pharmacy department within the trust for a long time. And so we have a mutual respect and confidence, I think, in each other's sort of systems. So they were happy to kind of endorse and support the MOU. So in terms of how it practically works, what happens now if somebody gets a positive hepatitis C test is obviously, firstly and most importantly, the worker needs to talk to the client and let them know about their test and gain consent for a referral to treatment or a treatment discussion, you know, in that sense.
Absolutely.
We are also part of a wider community liver screening programme within Greater Manchester, and so we are very lucky really to have, it's a fortnightly fibroscanning clinic running within the service. So we can directly fibroscan our hepatitis C positive people. If they're happy to have venous bloods done, we do bloods on site. We will do basic bloods really, but we don't do bloods for things like resistance testing because of cost. We would have to get the ODN to do that should we need those, really. So we do basic bloods. If people decline bloods, we're still very happy to treat without venous bloods. The dry blood spot test is enough. We would then book them really to see me, hopefully once I've got a fibroscan result and if they're having venous bloods done. And I do a treatment assessment really that obviously involves looking at their full kind of physical health, any other medications that they're on, their knowledge of hepatitis C, most importantly their understanding of treatment, how to take it, the importance of adherence to treatment, possible side effects, the risks of not treating, and the risks of reinfection in particular. I guess it really isn't uncommon for people to, I suppose, think that hepatitis C isn't that serious because they don't feel ill, you know, with it. And over the years, I suppose you see many a person who's adamant that there's no way they've put themselves at risk and are really surprised when they come back positive. So I think our message is test, 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 really, if there's any hint of risk, really, in that sense. So once we've done a treatment assessment, and the person feels that they're ready for treatment and want treatment, then I do an MDT referral to the ODN. That's discussed at their MDT meeting. They agree treatment. They will notify me if there are any interactions or any particular other things that we need to consider in that sort of sense. And then they send the medication here. We have an SOP for the storage and issuing of medication, and they then come to me for a treatment start appointment. We again reiterate all those same things around risk and adherence, side effects and management, readiness to actually engage in this, and the risk of resistance, really, if you start treatment and stop it, and that sort of stuff, really. We issue 4 weeks of medication at a time, and they get a £10 incentive in vouchers for treatment start and then each subsequent treatment review. So most of the hepatitis C antiviral treatments really are either 12 weeks or 8 weeks. So I would see people at that next 4-week slot for the next medication. We would be talking about any changes to prescribed medication. They're made very aware of the need to inform anybody else if they are starting any new medications that they're on these medications. I should have said we do write to their GP to say we've started medication and give them some information about medications as well. And then we issue the next lot of medication. We will do a dry blood spot test at 4 weeks. At 4 weeks, if they've been taking their antivirals properly, we would expect their virus to be undetectable. It doesn't mean it's completely gone. It means it's undetectable, and it's really important to just emphasize that to people, really, so that they complete the rest of their treatment. So if they're on a 12-week program, I'll see them at 8 weeks and issue the next medication. And if they're obviously on an 8-week program, I don't need to see them after they've had their first 4 weeks of medication. The next appointment is for their dry blood spot 12 weeks after they finish treatment, the sustained viral response, or SVR12, and they get another £10 voucher for coming to see me to get that done. Or their workers might do their dry blood spot test. They don't necessarily have to come and see me in that sense. And then we communicate those results, obviously, most importantly to the service user, secondly to the GP, and thirdly, or at the same time, to the ODN, hopefully as a successful treatment complete, really. So I think part of the process has been getting systems in place within the service. So we have an internal SOP and flowchart for workers to understand how treatment works. At the moment, I'm the only nurse in the service doing the Hep C treatment, but the aim is to get at least a couple of other nurses also involved in doing it. But we've been sort of I suppose piloting is the word, piloting how we work with the ODN and getting the kind of paperwork and the communication right, really, in that sense. So that's in a nutshell how we're doing it.
Wow. And as you say, you make it sound very easy. This has been a long process. And I think, as you say, it's around the relationships that have been developed. It's around everybody's confidence in everybody else. And I think even though you're saying it's a pilot, it's been a very successful pilot. So I don't know if you could just give me and listeners any feedback on this, I would say it's not a pilot anymore, particularly on this process. Any good, bad, ugly feedback that you've had since you've started the treatment within service?
So in terms of feedback, really, the positives, we've had, let's have a look, we've had 2 people who've successfully completed treatment. One's just had their SVR12 done, and we're waiting for their results. The next one, I think, is due in about 3 weeks for their SVR12. We've got 3 people currently going through treatment, and we've got 1 person left to treat in the service who has been resistant to treatment, who we've just got approved for treatment, and we've got a plan to start treating very shortly. I think in terms of feedback from service users, the ones that I've been treating, really, apart from 1 who was a new diagnosis and didn't know any other systems for treatment, are all people who had dabbled, if you like, with our previous hepatitis C specialist clinic. 2 of them had started and dropped out. 1 of them had never managed to make it to appointments on time, and missed. And I think they're the harder to reach people. And I suppose some of the feedback from service users is, oh, it's much easier this time round. And I think that's, again, relationships are important. These are people that I have medically reviewed over the years and had conversations with about hepatitis C. So they know me as an individual, and they have my mobile number as well as the service number to ring should they have any sort of concerns. I do tend to, after somebody's had their first week of treatment, just give them a quick call, just to check how they're getting on with the meds, really. And I think it's that relationship stuff that's probably been most powerful, really, in that sense. When you have a specialist clinic coming in, obviously it's within a defined window. Now, I'm not saying I'm available 24/7, 5 days a week. However, you can be a lot more flexible when you're in the service all the time. So we can tie in that they have their hepatitis C appointment at a time when they would usually come for their prescription and appointment with their key worker. So I think there are options, really, to have more flexibility in that sense. And so I think the feedback from service users has been really positive. You've made this really easy. It wasn't as bad as I thought it was going to be. I like the fact that I could just come and see somebody I know, are the sort of general themes from the people that have struggled to engage with treatment.
Thank you very much for talking to me today, and for all the work that you do towards eliminating hepatitis C. As we've already touched on, it's amazing to see Stockport Drug and Alcohol Service have achieved microelimination earlier this year, and you are absolutely on track to being able to redeclare for a 6-month point. So it's an astounding achievement, and as we've said, the treatment side of it just helps reinforce the maintaining and the sustaining of microelimination for you in Stockport Alcohol and Drug Service. If anyone listening to this podcast today wants to discuss any of the topics raised, or you want to know any more, there are resources available at www.hepculater.com.